More than 10,000 people in Georgia die from tobacco-related diseases each year. That's not counting the billions of dollars that we spend in healthcare costs, lost productivity, and all of the pain and suffering that people experience and our families experience as a result of using tobacco products. We're actively involved currently, and we have been for the last 3 years, in working with local communities and developing tobacco control coalitions that mobilize their communities to advocate for smoke-free environments, to change policies, to make sure that our youth will not be exposed to tobacco and that they won't take up the habit. That's the best way to lower some of these tobacco-related diseases and death and disability, is not to take up the habit in the first place. And these communities also focus on promoting resources to help people quit using tobacco. We have an excellent resource here in Georgia, the Tobacco Quit Line, that people may not be aware of, and so we want to make sure that anyone who is interested in quitting know that they can get free access to individualized counseling over the telephone that can help them quit. We worked with the Miller County Tobacco Coalition to sponsor a youth tobacco summit, and this allowed young people from throughout South Georgia to participate in a day-long event and be trained on how to advocate for smoke-free policies in their own communities. We brought in trainers who worked on several workshops with the youth, getting them prepared to talk to their school board leaders, for example, to establish new policies in their schools so that not only would people not smoke within the school system, which, right now we know that smoking is not allowed in the school itself, but also that parents and vendors and teachers and anyone who visits the schools would not smoke even at sporting events, during weekends, 24 hours a day, 7 days a week, to ban smoking in their schools. And so the kids got really excited about some of the things that they could do to promote tobacco-free environments. They worked on media ads, for example. They conducted radio interviews. They made announcements at some of their sporting events, and it allowed them a chance to show their leadership and develop new skills. Sure. Primarily in South Georgia, we focus on women of childbearing age because we have a high rate of women who continue to smoke during pregnancy. And that concerns us, of course, not only for the woman's health herself, but for that of the unborn child. Caucasian males, particularly white males between the ages of 25 and 45, have some of the highest smoking rates. And we also see a lot of smoking among youth, particularly teenagers, with the highest rates among white girls. So when we work in communities, we conduct a community assessment in each of the counties that we work in so that we can identify the specific groups that are more likely to use tobacco products, so that any kinds of programs that we develop will focus on those particular groups of people and be the most effective. The Cancer Coalition will continue to focus on tobacco use. It's one of the primary causes of cancer, and as I said before, one of the leading causes of not only cancer deaths, but other tobacco-related disease. So we will definitely focus on this as a high priority for this region, particularly because 1 in 4 South Georgians continue to smoke. And that is one of the highest rates in the state of Georgia. And so we know that we need to have a very heavy emphasis on reducing tobacco use in South Georgia.